My name is Jess Shafeli, and this is my presentation on esophageal varices. The esophagus is a complex structure in the gastrointestinal tract located behind the trachea that connects the pharynx to the stomach. This muscular tube is approximately 25 to 30 centimeters long in adults, and its primary anatomical function is to provide a channel for food, fluid, and gastric contents to pass through. The esophagus is made up of muscle, mucosa, blood, lymphatic vessels, and nerves. There are a few diseases and abnormalities that can affect the structure and function of the esophagus, such as esophageal varices, resulting from portal hypertension. Portal hypertension occurs as a complication of liver cirrhosis. Portal hypertension is defined as an increase in blood pressure in the portal vein due to the scarring from the cirrhosis. Portal vein is the main vein that transports blood to the liver from the rest of the body. Approximately 50% of patients that are diagnosed with portal hypertension go on to develop esophageal varices. Varices will form when the portal pressure reaches 10 millimeters of mercury, and a bleed will occur when the portal pressure exceeds 12 millimeters of mercury. Esophageal varices is a bleeding disorder of the upper gastrointestinal tract that occurs due to a complication of portal hypertension caused by liver cirrhosis. Most commonly, it's the distal third of the esophagus that is affected by the varices, resulting in enlarged veins in the submucosa of the esophagus. If the varices rupture, they can result in life-threatening bleeding if not managed correctly. As well as bleeding, other signs and symptoms to watch out for are hematemesis, melena, or black tar-like stool. Ruptures in esophageal varices follow Laplace's law. Laplace's law results to how the pressure, radius, and thickness of the esophageal wall can contribute to esophageal wall tension, increasing the risk of rupture. The most common place for the varices bleeding to occur is at the gastroesophageal junction because this is where the varices are thinner, so increase in pressure will result in an easier rupture. Diagnosis before the first episode of bleeding or rupture is preferred and is usually obtained by an upper gastrointestinal endoscopy. Patients with a diagnosis of chronic liver disease will receive regular upper GI endoscopies to screen for esophageal varices. Repeated endoscopies are not ideal for the patient or the healthcare system, so there are also a few non-invasive test options available. Tests such as laboratory investigations assessing liver function and abdominal ultrasound to assess portal vein flow, portal vein diameter, and spleen diameter, which may help determine the likelihood of esophageal varices occurring and their severity. Esophageal varices are graded using several different scales. However, the one that is the easiest to understand is the Westerby classification. Grade 1 means the varices occur as a slight protrusion above the submucosa. Grade 2 means the varices occupy less than 50% of the esophageal lumen. And grade 3 means that the varices occupy more than 50% of the esophageal lumen, which you can see in the pictures here. Pre-hospital management of esophageal varices rupture needs to focus on correcting aspiration and hemorrhagic shock. This is achieved by providing airway management, intubation, bleeding control, and fluid resuscitation, as well as rapid transport to the nearest hospital. Medication management, such as somatostatin, can be used during an active bleed to tighten the blood vessels to help reduce portal vein pressure. If there's been no rupture or bleeding but varices are known, then prophylactic beta blockers such as propranolol are suggested to help reduce portal vein pressure. At hospital, treatment will most likely consist of endoscopic sclerotherapy and endoscopic band litigation. Endoscopic sclerotherapy works by treating the varices by injecting a sclerosing agent into the lumen of the varices via an endoscope. This provides immediate coagulation and external compression of the vessel, which over time and with repeat sessions should result in variceal destruction. Endoscopic band litigation is another endoscopic procedure that fixes elastic bands around the varices, which stop the blood supply through the varices so they can't rupture and bleed anymore.